Good day. Today we will discuss how the endodontic access cavity is prepared. The factors which will alter the technique of access cavity preparation are altered tooth position and angulation and altered external crown form, altered internal crown form like in pterodont teeth. For this, intraoral periapical radiograph is mandatory. The intraoral periapical radiograph in different angulations will help to evaluate the position of pulp space in the tooth. The radiograph also will help to identify calcifications, number of roots and canals, canal length and different configurations. This will help in directing the initial burr penetration while preparing the coronal access cavity preparation. The coronal access cavity preparation for anterior teeth usually is done on the lingual side and for posterior teeth is from the occlusal surfaces. This will help in providing straight line access from orifice to the apical foramen and it will be least unesthetic. The cavity preparation is broadly categorized in coronal cavity preparation, which involves the crown preparation and radicular preparation in which the root canals of the teeth are prepared to receive a specific type of filling like gatapacha. These are the different burrs used to prepare the coronal cavity preparation. These are the safety tip burrs which will prevent gouging in the coronal portion and perforations in the furcal areas of the teeth. These are endodontic explorers. They are used to identify the canal orifices and explore the canal orifices. The second one is endodontic spoon excavator. It is helped to remove the coronal pulp and carious dentin. These are some endodontic ultrasonic tips. They are used for troughing and deepening the developmental grooves and remove the tissue and explore the root canals. These are Gates-Glidden burrs. They are used to flare or enlarge the root canal orifices so that the access to the apical foramen becomes easy. There are certain principles to prepare the endodontic coronal access cavity preparation and they are analogous to the G.V. Black's preparation like outline form, convenience form, removal of remaining carious dentin and toileting of the cavity. The outline form is influenced according to the size and shape of the pulp chamber and number of the root canals. In convenience form, the access cavity is expanded so that the instrumentation becomes easy. Removal of remaining carious dentin at the onset of access cavity will help in reducing the bioburden and removing the microorganisms as much as possible. Now we will see the coronal access cavity preparation on maxillary central incisor. So this video will show how the cavity is prepared on maxillary central incisor. So maxillary central incisor, on radiograph you can see that in young patients the pulp chamber is wide with single root and single canal. The chamber is triangular, so access cavity will be triangular in shape. To start with a round burr, burr is held perpendicular to the long axis of the tooth on the lingual surface till you reach dentin. It is done in the middle third of the tooth, just incisal to the cingulum. Once you reach dentin, the burr is held parallel to the long axis of the tooth to take access to the pulp chamber. In young patients, you get drop-in sensation that indicates that you have reached the pulp chamber. With explorer, you identify the chamber and remove the remaining dentin. Extend the cavity to involve the entire pulp chamber. With explorer, check for the pulp horns. They have to be removed. With round burr, extend the cavity to involve the entire pulp chamber and now you remove the lingual shoulder. Lingual shoulder is an overhanging dentin on the lingual surface. With tapered fissure, you remove the lingual shoulder. If you don't remove it, there will be hindrance to the penetration of the instrument. You can use GG drill also to remove the lingual shoulder. refine the cavity and then put the barb broach with EDTA to remove the pulp tissue. Continuous irrigation with sodium hypochlorite is done. This will help in flushing and dissolving the pulp tissue. Piezo removers can be used to flare the coronal portion so that easy access to the apical foramen will be taken. This is how the prepared cavity looks like. It is triangular in shape and reflects the internal shape of the pulp chamber. If you don't expand the cavity adequately, then the pulp tissue will not be removed completely, which will get degenerated and tooth will look discolored like this. The access preparation for the maxillary lateral incisor is similar according to the size and shape of the pulp chamber. It could be oval or it could be triangular in shape.